friends, today I want to share how to prepare for the annual Medicare Open Enrollment period that runs from October 15th through December 7th. Now, when it comes to researching and comparing all available Medicare plan options, sooner is always better than later. And as a family caregiver who already have a lot on your plate, now is the perfect time to do some research and make a few preliminary calls to get an idea of what changes, if there are any, need to be made to your loved one's Medicare coverage, right? So preparing before the enrollment period begins will prevent you the caregiver, from scrambling to get the information and advice you need, right? So today I want to share some things you can do to prepare for the open enrollment period, right? Number one, make sure you're familiar with the different parts of Medicare and how they work together, because Medicare have different parts, right? Also, think about, does your loved one currently have a Medicare Advantage plan? And if so, is that still working well for them? Another thing is, you want to make a point of opening all mails from private insurance provider that arrive during this time period, so you can be on top of any changes to premiums, deductibles, copays, etc., right? Another suggestion is, do your loved ones have a Medicare supplement insurance policy? If they do, make sure you pay attention to any premium increases, right? Because at some point your loved one may need to consider switching to a different policy, or maybe possibly dropping the policy altogether, right? Another suggestion is, if out-of-pocket spending on hospital visits, prescription drugs, and doctor's appointment has increased in the current year because your loved one doesn't have the Medicare supplement insurance policy, now is the time to add up those costs and decide whether a different mix of coverage would be a more affordable solution, right? It's also worth looking into public programs that can assist with covering healthcare costs and premiums, such as, of course, Medicaid. There's also state Medicare savings programs or the extra help programs, right? Also, go to the State Health Insurance Assistance Program, SHIP, and look up the location for your local area. This program usually has counselors located at area agency and agent, and they often put on public presentation each fall that cover changes in Medicare for the coming year and offer one-on-one counseling, right? And my understanding is that appointments tend to fill up quickly, so you want to move on that, right? And this service is completely free. Now, the other thing is, you want to make sure you have up-to-date information about your loved one's current health status and future needs, right? Are they due for an appointment with their primary care physician? Will they need a referral to see a specialist in the near future? Would adding dental, vision, or hearing coverage be beneficial in the coming year, right? So make sure you have a current list of all their medication, right? And know exactly why they are taking each one of those medication, right? And also, I would suggest, if any of the prescription are brand name, ask their doctor or pharmacy if they have a generic equivalent available, right? And I would suggest, as a caregiver, 20 minutes of preparation here and there can save you hours of frantic work when, come November and December, right? So that's what I want to share, right? So the annual Medicare enrollment period is October 15th through December 7th. And you really, as a caregiver, you really don't want to wait last minute to do it. Just doing 20 minutes here and there, or maybe 20 minutes every day, and start working on it will really get you prepared when the time comes, because, the holiday comes up really quick on us, right? And you don't want to be dealing with that on the holiday, the holiday season that's upon us. Well, nevertheless, my name is Alicia Forbes, your dedicated senior advocate. Thank you so much for watching this video, and you have an amazing day. Bye-bye.